It's been a busy but challenging year, and it's been a good year on the whole, and that's down to a great team effort by everybody in the organisation. Great to have the CQC Goods rating and retained it, and actually better good than last year with some outstanding services across some of our areas, which is fantastic. So really, really, really well done, and a really good piece of work.
One of the other highlights of the year for me was the staff survey results. They improved dramatically this year. Still more to do, absolutely, but that involvement, that investment in staff, that engagement with them should really come to fruition this year.
We introduced a safety huddle around February last year, so in 2018, and that was in order for our team to have a really comprehensive overview of all the risks that were occurring across the organisation, incidents that are occurring in the last 24 hours, so we've got that real-time view of safety. One of the big benefits of it is because we're actually reviewing the incidents in the safety huddle, we're able to close a lot of them down, which takes the pressure off the frontline managers. What we've been doing as a trust is rolling out safety huddles into teams as well, so there's that connection between the team level safety huddles and the corporate safety huddles, so the two connect together, so you get that real ward to board view of safety huddles.
It's been a brilliant year for research. We've had some really good things to celebrate. This year we had over 1,500 people take part in research projects. Of the people we've surveyed, actually 100% of them have said they'd recommend research to family and friends, so it's been a real positive for us this year. I've actually got some quotes here from things participants have said, because this is the important thing for me. It's about how we change lives. So, research gave me the hope I so desperately needed, helping to live instead of dreading the future. It's made me feel proud and important. Research has given me a focus and a purpose. Life is worth living after all. So I think that sums up why we do research, why we celebrate it.
We were set up as part of the mental health sequence, and our main aim is to work between A&E department and mental health, and we look at people who frequently attend A&E, that is 10 or more times in 12 months. We created very personalised care plans that we shared with A&E department for the medical staff, and some care plans for mental health and other professionals. By doing that, we achieved 40% reduction in attendance. Our target was 20%.
What we've been able to look at a lot of this year is it's been reporting. So I've been in 6 months now, and so a lot of what we're doing is a Equality and Diversity Annual Report, reviewing what went well and what didn't go well last year, gender pay gap reporting. Then also we're reporting to the NHS's Equality Delivery System, the Workforce Disability Equality Standard and the Workforce Race Equality Standard. So my first 6 months have really been to get to grips with that and get that through. And we've been able to really move a Equality and Diversity Annual Report into something that's an actual useful document, rather than being a tick box exercise. We have this. It's more now something that can drive us forward. And now we're starting to look at implementing that.
It was actually quite an amazing journey for us over in Smash, really, because obviously we were, myself, I spoke to the CQC inspectors and obviously answered some of their questions. And when the report came out, yes, it was absolutely fantastic that the trust got good. Smash itself was actually rated outstanding, which for us was absolutely mind-blowing. We were blown away, the families were blown away, and the young people that we work with were absolutely ecstatic. In our Smash groups, we actually did some celebration around the CQC rating, and I actually asked parents to kind of feedback as well. So for us, it was absolutely fantastic, and to be part of the trust where the rating is overall good is just amazing.
We've developed a patient care experience dashboard. It went live in April last year. We get absolutely fabulous feedback. We're always on average over 90% satisfaction recommendation scores every month. The feedback that we actually get, the majority of it is very positive. We obviously like to look at what the negative feedback is as well, so that teams can look to see where they can make improvements to make that experience better for the patients' care service users the next time they use the services.
We've had quite a few enrolments on our apprenticeship programmes. They range from healthcare support workers and adult care workers through to administration, and we're now developing our nursing associate apprenticeship programme as well. Now there's a huge number of different apprenticeship courses that people can choose from level 2 through to level 7, so it goes up to master's level. We've got a lot of good feedback from our apprentices who are on programme in terms of their skill development and their ability to be able to provide more enhanced patient care and just have that knowledge and understanding that they are providing or doing the best job that they can do.
Obviously we're just delighted that we've maintained our good rating, but we're really wanting to aspire to be outstanding, and I think there is a recognition that we have such a wealth and our diversity within our professional workforce of expertise and experience and innovation and ideas, and we think that that is a key strand in driving us forward towards getting an outstanding rating. Spent a lot of time thinking about what we think the professional priorities need to be over the next 3 to 5 years, and to look at some of those things that we can deliver quickly and easily, and some of the things that are really aspirational about where we want to see professional leadership and demonstrate to the wider community, what we contribute and the impact that we have as professionals, and to attract the very best of all of our professional groups to come and work with this organisation, because it is just a fabulous place to be.
All I can say is that keep the good work going. And I think you are doing well. There's always room to improve, and the dedication that you have shown so far, I'm sure it will make things even better.
Thank you for everything that people have done throughout the year. You've been a credit to Humber, and I'm really proud to work in the organisation and work with such fantastic staff.